COVID-19 continues to spread throughout the state of Florida. Today, the CDC reports 38,341,339 positive cases and 631,440 deaths. Now, if you look at this latest graph right here from the Centers for Disease Control, it shows death data going down in the state, which had some wondering how that could be when just a few weeks ago this line was pointing up. All right, so it turns out it's because of how data is collected. 10 Investigates Jennifer Titus spoke with a USF epidemiologist for a deeper dive into the numbers and to find out what this means for you.
So the black line is basically the way that information is reported right now, deaths based on when they occur. The red line is how information used to be reported, which is deaths based on when they are reported.
Epidemiologist Dr. Jason Salemi says this is the best picture you can get on the recent changes the state of Florida has made when it comes to reporting data to the CDC. A few weeks back, the numbers you'd hear us report were based on when the cases and deaths were reported to the state. Now the deaths are recorded when that person passed away, and cases are recorded when that person tested positive.
Nothing has happened to that total number. It's just the distribution of deaths by date is different. Now they're based on not when they were reported, but when they actually occurred. And again, I don't think there's anything nefarious. It's just you have to know how to analyze the data and the strengths and weaknesses of looking at that data.
When asked why the Florida Department of Health changed the way they are reporting the numbers, the governor's office tells us 11 other states and New York City report COVID deaths the same way Florida does, by date of death. And Florida uses the CDC's definition to count COVID deaths.
Now, why it might be a little bit concerning is that if you would have been tracking the numbers the way they used to be reported, you would have seen a big rise in deaths at the end. If you track them the new way that they're being reported, even though it's more accurate, you would see a decrease at the end. And so people analyzing the data from one day to the next would have seen this very big change and wonder what happened to now seemingly make the situation look better in Florida. And again, this is where just no matter what you're looking at, there are limitations and strengths of that approach. This is the most accurate file. And if you ask me for a state, if they were going to report death information to me, this is how I would ask for it.
This information only came to light when media outlets started to ask questions. 10 Investigates did ask the Department of Health why they did not let anyone know about the recent change in reporting. They didn't get back to us, but we'll stay on top of this until we get you some answers.